Right, it's good to be here and see you all. I was asked by Dr. Song to talk about academic advisement for the at-risk resident and some of the services that we can provide through the Office of Academic Success at OSU COM. So that's what I'm kind of going to go through today to discuss when it's an appropriate time to refer and what things we can really help with. Our primary referrals that we receive are usually centered also around complex level 3 remediation or complex level 3 preparation. So I also wanted to focus on some of those things that we talk to residents about who are maybe struggling with that. So I'll kind of provide those as references, and if you all have copies of these slides to refer back to, I can certainly get that out. So this is our office as it currently stands. So we've enlarged significantly since I've been there for the past 5 years to really support the needs, not just of our medical student body, which has grown significantly over the last couple of years, as well as meeting the academic and career advisement needs for our PA students, and then also working with some of our graduate students and then now residents as well. So we have an assistant director, Dr. Bradbury, out in Tahlequah, who helps a lot with academic advisement. And then we currently have 2 academic counselors who work full-time with our primarily first and second year medical students. We also have career advisement, and so most of you have talked with Tanya O'Grady in the past. She's our full-time career counselor on the Tulsa campus, and then Jessica Langston has been there almost a year. She's our full-time career advisor on the Tahlequah campus. So these 2, in addition to me, help with a lot of the career advisement that we're providing to our primarily 3rd and 4th year medical students. So resident referrals to the Office of Academic Success. So how can we help you all? What are things that we think we could really help to provide to your residents who are possibly struggling. So any resident who has previously filled COMOS level 1, or if you have MD residents who have filled USMLE step 1, or possibly even a DO student who's taken USMLE step 1 or COMOS level 2, USMLE step 2, and they're preparing for COMOS level 3 or USMLE step 3, those should be considered at-risk residents. And we really prefer to work with those residents earlier rather than after they possibly fell COMOS level 3. A lot of the referrals that I get back and in terms of residents are residents that I previously worked with the students. I have a good working relationship with a lot of these people, at least the graduates who have previously come through our school. And we can really kind of go back and focus on what made you successful on COMOS level 1 or COMOS level 2, and what can we do to help you kind of make you successful on COMOS level 3. But ideally, having these conversations and making a really good and structured study plan with these residents before they end up getting into trouble with boards. Any resident who has not met any academic requirements that your program has prior to sitting for COMLEX level 3. So we have a gating policy at the school for COMLEX level 1 and COMLEX level 2. Our students have to meet certain benchmarks before they're allowed to sit for the exam. And so if you have something like that in your program where they have to meet these certain criteria, but they're struggling to get to that point, they're not meeting these requirements, we would love to be able to work with that resident and intervene earlier rather than later. And then of course, any resident who has failed COMLEX level 3 or USMLE step 3, and we're working towards a remediation goal, or for that matter, any other certification exam that occurs during graduate medical education. So the process for resident referrals to the Office of Academic Success. So the program director initiates a request to Dr. Song, the DIO, with documentation of the academic concern. So what's going on, what's happened, what have you done to help this resident, and what things are you kind of looking for that we possibly could provide. The DIO reviews documentation and collects any further documentation that's needed from you all, and then any approved referrals are sent to our office. I usually try to meet with my residents as soon as possible, usually within a week or 2, of course, trying to work around their schedule. And then after that, I generate a report and I send that back to you all and also back to Dr. Song. So other areas that we can help as far as consultation services for difficult situations. So if there is a resident who in general has poor test taking skills, maybe this doesn't just relate just to COMLEX level 3, but maybe an in-service examination or something else, they're really trying to help that resident improve their test taking skills in general, we can certainly help with that. We have we do lots of work with our students in test taking. Test anxiety is a big one. We realize lots of students have test anxiety, lots of residents have test anxiety. We have a lot of wellness resources on campus, but we can also provide some intervention and some help with test anxiety. Poor performance on in-training examinations, so another reason that we can help in that regard. And then anything else that may be related to a really difficult situation where the resident's having particular difficulty with like clinical organization deficiency. So consultation services we're happy to provide for those residents as well. So different things I listed here that may affect exam performance. I oversee all of the board preparation for Complex Level 1, Complex Level 2, and our CONAT examinations. I get a lot of help from a lot of different board prep coaches on campus, so different faculty. But these are the things that where we see students primarily struggle with. The same thing with residents. So lack of dedicated study space, sometimes it really does come down to a matter of lots of different things, but part of it being actual study space. Where is the student or the resident spending most of their time studying? Are they having too many distractions? Do they need dedicated study space? Sometimes home is not the ideal opportunity or space to study, and maybe no longer they're at a location where they can easily access the school or somewhere else where there's a low distraction environment, but helping the resident find that space. Lack of time to study. That's probably one of the biggest ones, particularly with residents. They're busy, they're working a lot, but really looking at their rotation schedule and really trying to identify, is there something we can help the resident with so that they do have a little bit more time to study. Lack of effective resources. It sometimes happens. More often, I think we see them struggle with too many resources and kind of trying to pare down the resources that they should actually use. That's kind of a good and bad problem in the current culture that we now live in. When a lot of us went through this process, there wasn't a whole lot of resources, and we begged for more resources. And now there's so many that residents and students really struggle with which resources are the most effective and which will really work for their learning style. Lack of practice exams. I'm going to talk about a few practice exams that residents can utilize to their advantage. We require that our students do several practice exams before they sit for boards, just to really identify, do I have any issues with test taking? Am I doing well on timed questions? Am I being able to skip from different types of questions instead of just focused questions? And really, where am I standing? What's my assessment score? Any prior academic struggles with standardized exams. So some people are just not great standardized test takers. Those are usually the students and the residents that we're working with. It definitely is a problem that can be helped over time, but some people just really struggle in general. Lack of effort, accountability, and dedication. This sometimes is more of a professionalism concern than anything else. But students taking effort and accountability for what they're doing to get to the end point of passing this exam. Poor test taking skills, like I mentioned, there are resources that we can provide the students. We now provide a book to all of our students about test taking skills in general, and we ask them to read through it and really get some insight about how do you actually take a standardized exam, and what are some things that you may need to consider if you're struggling in that area. Test anxiety, I mentioned, the inability to create a realistic and effective study schedule. So this is another area where we can really help our academic counselors with students all day long to help create study schedules that are not just structured, but also realistic and effective. Which is really where some students and residents struggle. And then any outside factors that may be contributing. So do they have outside family obligations? Are they maybe moonlighting too much? Are there extracurricular activities that they're participating in that may be impeding their progress? So just a couple of slides here. Most of you are familiar with this, but just I wanted to really show this with Complex Level 3 because our students a lot of times have difficulty with endurance and stamina on Complex Level 1 and Complex Level 2, which are both only one-day exams. A lot of times when I'm working with residents for Complex Level 3 remediation, I hear all the time that I think I did great on the first day, but man, that second day just wiped me out. I think that's where I really struggled. And some of it may have to do with the CDM cases. I hear that from residents a lot. They struggle with the CDM cases. They weren't as prepared as they thought they would for those. But part of it may also be, were they prepared for the timing? Did they have the endurance? Did they practice endurance and stamina? Did they take multiple practice exams to really make sure that they can sit through and get through a 2 hours or a 2-day exam? Format for USMLE Step 3 is very similar as well. So 2-day exam with CDM-like cases. I wanted to put a quick note on here about testing accommodations because I work with several residents who previously have either applied for it and been granted or applied for it and been denied accommodations. And the big question, now they're getting to a Complex Level 3 or USMLE Step 3 or some sort of other exam that they need to take during graduate medical education, and they're asking about accommodations. We know accommodations are requested more frequently than they've ever been before. The number one request for accommodations is because of ADHD, for extended time and low distraction environment. However, they are rarely approved. And so what I usually advise our students is that you need to apply very early. You need to submit very thorough documentation. If you previously have been approved to have accommodations, that does increase the success of you possibly being able to get an accommodation on this exam. But it's something that they just need to be aware of, and they need to know the process for actually requesting accommodations. The documentation has to be very complete. It has to provide professional evaluation and prior records. Again, the most commonly requested accommodations are extended time and low distraction environment. However, these are rarely approved. And there are expedited accommodations as well. This is something that a lot of our students don't know about until we inform them, but there are certain pregnancy accommodations that students can receive, and residence diabetes accommodations to have like an insulin pump or a private room. Lactation accommodations provides usually accommodations for a private room, but also extra break time. And then any personal item exceptions, where they can kind of get an expedited process if they require something like an insulin pump or some other sort of device. So this is just important for them to be aware of. A lot of these students and residents get very anxious and very concerned about the possible need for a private room or extended breaks, and they're not allowed it, and they're not aware that they can get possible accommodations for those types of things. Conference level 3 registration and scheduling, just to note, it's expensive. We all know that. The rescheduling and cancellation and no-show fees are really expensive. And so we always help, our students to, really realize this needs to be very realistic. If you're on a timeline that's set by your school or by your program, you need to realize, when it is that you need to schedule your exam date. Hopefully that's a realistic time frame so you don't have to cancel. And as July last year, there were limited 4 attempts at each complex exam, including complex level 3, as part of the new NRMP requirements. Okay, so just a few notes about resources. Sorry, this doesn't show so great over here. So a few things here I just wanted to kind of go through quickly, and I'll provide this information to you all as well. Your students are aware of these question banks usually, and resources and residents sometimes are. And so it's just good for everybody to have kind of this information to know what sorts of things you could be talking to your residents about to help them be successful on these exams. So question banks are huge. We tell our students that question banks are as important as any other resource in preparing for exams. And we usually create their study schedule around a structured plan for getting a certain number of questions in every single day, and meeting certain benchmarks as they progress through questions. So there's lots of question banks available for complex level 3. TrueLearn is one that I know a lot of you have institutional subscriptions to, and something that our medical students use very commonly. The question bank contains a lot of multiple choice questions for complex level 3. It does have a testing interface that's identical to Pearson VUE, which students and residents really like because they get into the actual exam and they realize this looks just the same as what I've been practicing on. It also includes CDM cases, which is nice. There's a lot of element videos that are now included in the subscription, which is great. UWorld for USMLE, step 2. They don't have a subscription package for step 3, I don't believe at this point in time, but there are 2,100 multiple choice questions. It's a similar testing interface. There are 40, excuse me, I think this is step 3. Dr. Duncan, do you know if that's?
There is one for step 3.
For step 3, okay, yep. So, sorry, that's misprint. So UWorld for USMLE step 3, they do have a subscription package for now. So 2,100 plus multiple choice questions, similar testing interface. Our students use UWorld. It is a very USMLE style question bank. However, a lot of students really like their thorough explanations and the way they pose questions. And so even for students who are preparing for complex level 3, UWorld sometimes is a really great resource for them to be able to use. It does include 40 plus computer-based case simulations, a biostatistics review, which was recently added, which is nice. And then it also includes 2 self-assessments, and that's kind of nice for students or residents who are still looking for additional assessments. Conquest is another question bank that's available. 1,800 multiple choice questions. They now have 14 CDM cases with a total of 45 questions. And the nice thing about Conquest is it's the only question bank where a student or resident who's using the question bank interface can put a lot of questions up to 400 and create basically a mini assessment. So if a resident's looking for another way to test themselves, or you're wanting to use this as a way to maybe see where the resident is at, they can put a large number of timed and random questions into a practice exam, and it will generate a predictive score. And then AMBOSS is kind of a newer kid on the block. A lot of our medical students are using AMBOSS, but they have an entire question bank, and they also have the new clinician subscription as well. A practice exam, so again, I think this is a big part of helping students and residents know when they're prepared to take these exams and really trying to help them identify not just if they're ready to sit for the exam, but is there something else that they could be doing differently to even prepare better for the test, whether that comes down to test taking issues or something else where maybe they're is strong in an area but weaker in certain areas. They can really kind of hone into those specific areas. So NVOME does have a free practice exam for Commonwealth Level 3. It's available on their website. They provide a tutorial for the CDM cases, which is identical to the tutorial in the actual exam, which is also nice for residents to be able to see that before they actually get into the exam and receive that for the first time. So it's a practice exam that includes 25 multiple choice questions and 11 CDM cases, and it's completely free on the NVOME site. They do have a phase 3 CompSay, so we have CompSays for level 1 and level 2. There's only one available for Commonwealth level 3. It does not include CDM cases, but it does include 200 multiple choice questions. The resident or the program, whoever purchases it, can set it up in timed mode versus self-paced mode. So when we purchase these for our students, we always set them up in time mode. We try to make it as realistic as possible to the actual exam and the environment where they're going to be taking the test. So this may be purchased by residents or it could be purchased by program directors. The residents do get a score report after they've completed it, but they are not able to review the questions after completion, as is true with all of the CompSays. And then TrueLearn also has an assessment. So built into their institutional subscription packages is an assessment. We use it for all of our students preparing for Commonwealth Level 1. It includes 200 multiple choice questions that are not included in the question bank. So these are entirely separate of questions that they previously have seen. It provides assessments for and a score report. The thing about the assessment for TrueLearn is that the resident can't just go in there and take it. Somebody in your department, whoever's your administrator for TrueLearn, if you have that subscription, needs to actually go in there and actually turn it on. So they actually have to activate it or assign it to the resident. And if you need help with that, I can certainly help with that. Additional practice exams, so for students preparing for USMLE Step 3, but also maybe Commonwealth Level 3, another way to get them help with practice exams is the USMLE Step 3 Comprehensive Clinical Medicine Self-Assessment. There are multiple forms of these available. Our students commonly use these for Commonwealth Level 1 and Commonwealth Level 2 as another way to self-test. 176 multiple choice questions. It can also be placed in timed mode or self-paced mode. And the residents, unlike the CompSay, can go back and review all of the answer explanations after they complete it. And then NVME has also recently released clinical science subject exams. So these are more so for shelf exams or COMAT exams that students take during year 3. However, if a resident is particularly struggling with a specific subset of Commonwealth Level 3, family medicine, peds, whatever it may be, they could purchase one of these exams and maybe see types of questions or maybe areas of weakness in that specific component. So they can purchase those on the NVME website. So additional resources. So again, when I'm working with residents a lot who have failed Commonwealth Level 3, a big component when we're talking through why they possibly failed is that they feel like they were not prepared well enough for the CDM cases. So there are several resources for CDM cases, including question bank. The other one is cdmcases.com, which includes 140 CDM complex specific cases. They're given feedback and grading for each case based on the student or the resident's responses. And it's fairly inexpensive for the resident or the program potentially to buy. Online Med Ed is a common resource that our medical students use, residents use it as well. There's a new residency bundle that includes a lot of stuff, including a bunch of case scenarios and different videos on clinical sciences. And the Dirty Medicine is something that our students really like, our residents that I've worked with like it as well. It's completely free on YouTube and has a lot of clinical content, also has OMN videos. And a big thing usually on Commonwealth Level 3 and Level 2 is communication and ethics. And so it also has a lot of resources for those two components. A few other resources. Randy Neal is known kind of as the king of biostats. And so biostats is commonly tested on all Commonwealth exams, including Commonwealth Level 2 and Commonwealth Level 3. So a lot of our students use Randy Neal videos. Divine Intervention podcasts, they have these available now for Step 1, Step 2, and Step 3. So for residents who are traveling a lot, they're in their car, or they're very good audiovisual learners, and they get a lot just listening to things. Some of these podcasts are really great. And then Anki, we've found that over the past several years, our students have become huge fans of Anki. When I first started, very few students knew how to use Anki, but now almost all of our students use Anki. I think a lot of residents use Anki. It's a great source for spaced repetition. And so there's a couple of really great Anki decks for all levels of boards, but the turn up to OMT and the turn up to law and ethics Anki decks are highly utilized for level 3 in addition to level 2. There's a lot of different book resources. Some people like learning via books and some people don't, but these are things that I usually discuss with residents, is to have some sort of book resource if that's how they feel they're going to get some information. And then just know that there's lots of board preparation courses and tutoring resources. And so some of the residents who I'm working with have already been through some of these programs before. They realized they were beneficial, and maybe this is going to most increase their success for passing complex level 3 or US only step 3. So lots of resources available. I put the websites associated with those, and then also lots of tutoring services that residents may get additional benefit from. So a few considerations for at-risk residents, kind of just to wrap up. So the things that I hear a lot from residents is that they like a very clear timeline and expectation. They want to know, when do you expect them to retake the exam? When do you expect them to take the exam for the first time? What timeline they're on, and what are the expectations of getting to at certain points? What are the consequences if the expectations are not met? So maybe that's a gating policy that you have in effect, that they have to meet certain criteria before they can actually sit for the exam. And if they don't meet that criteria by a certain time frame, what is the consequence if that occurs? What is the consequence if they're not able to pass complex level 3 by a certain day? They need to know those things. Sometimes residents work best under pressure, so that sometimes is helpful. Early referral again to our office. So again, we like to be able to intervene and work with these residents sooner rather than later. So if they're already identified as an at-risk resident because they've either struggled with boards previously or they failed boards previously, we'd like to see them even before they sit for complex level 3. Providing effective resources in a low distraction study environment. So resources that work well for the residents, and then somewhere where they can really sit down and study. Use of practice exams. Definitely I listen to those utilized enough when I'm meeting with residents. A lot of them haven't taken any practice exams before they set for the first attempt. So using practice exams as a way not to only measure preparedness, but also, to identify other weaknesses or maybe gaps in their study plan. Or another metric is a gating policy prior to the resident being allowed to sit for complex level 3. Providing adequate study time. I know this is a major struggle, especially with their schedules, but really looking to see is there anything we can do to restructure the rotation schedule or to provide them with some study time outside of the hospital or the clinic. Routine and frequent follow-up. So not just from our office, but also from the program director or any of the key faculty who are really working with the residents to help them meet their academic goals. And then referrals to outside resources as needed, something we can assist with as well. A lot of times we're meeting with students and residents for academic concerns. There are also underlying concerns that relate to wellness. And so that's something that we work very closely with our wellness office for, in addition to, like I mentioned, work preparation courses and tutoring services. Right, and I'll provide again copies of this information. These are the things that we commonly meet with and talk with residents about, so just kind of some information about some of the things that we're discussing when residents are referred, and really, what we can do to support your program and your residents. I'm happy to ask you questions.
What's the book that you recommended for testing Gilstrap?
So there's it's by Dr. Stefik, and it's I'm trying to think of the exact name. Second. I know it by heart because I look at it frequently. I think it's just how to study for standardized tests.
It is.
Is that what it is? Okay, yeah.
In my mind.
Okay, I was gonna say, I have multiple copies of books, but it's just how to study for standardized tests. It was written by Dr. Stefik, who's actually a DO, and it had a lot of really great tips. I've read through it multiple times myself. I don't consider myself a star standardized test taker. I've struggled definitely in the past, but I think I've become a much better test taker. And some of those things in there I really would have known earlier on. So we encourage all of our now first and second medical students to kind of look over that. Yes. Exactly, yep, and then she'll look over and see if there's any gaps in the documentation or anything additional, and then once those are approved, then she sends those to my office. And again, I try to meet with the residents, you know, a lot of times in the evening, because I know that's what they're scheduled, within 1 to 2 weeks, and then generate a report and kind of provide any additional recommendations, that I can help with.
What if you have a large number of those?
That's where things may get bogged down a little bit. So you know, and I think that's the thing, like we're here to support you all, and if it looks like there is, you know, more of a need for academic advising for residents, that's certainly something that our office is willing to explore to see what are the ways where we can increase our ability to help with residents.
I'm gonna blame it on COVID, but that, a large number.
Yeah.
One of the other things that I want to point out, and then Brian will get to your question, is Dr. Gilstrap, similar to what Dr. Farrar and I started doing, was making a handbook for simulation about like how to use simulation, like for OSCEs and this, that, and the other. Dr. Gilstrap and I are working on making a handbook for like resources, so it's not an immediate referral to academic success, which we really want you using your CCC, implement those when they fail. We have academic success as kind of, I don't want to say last resort. But one of the things that we talked about was just sometimes you just need to pick up the phone and call somebody. And it's not sending the resident to the academic success committee, but it's like, hey, I just need to call Dr. Gilstrap and get some advice on like, I think that's probably a better mechanism, minus like kind of standardized, hey, they're failing their test. But that might be a better mechanism. You just don't want to number one, we want to show that the programs are doing what the programs are supposed to be doing. And then using this as a resource, not as the, hey, we're sending this to you so that you can fix my resident. Not appropriate. So that's what we're trying to kind of protect.
Yeah, and sometimes it's something very specific. I mean, we see that a lot with students where, you know, their knowledge base is good, but they can't get through a question quickly. And so it really comes down to timing. And so that's where I think we can help you with like the phone calls, the consultation. What can you do to help a resident with time questions? You know, what can you do to help a resident, you know, with testing anxiety or whatever it is. Sometimes it's the full picture. We need to work on a lot of things, but sometimes there's something that's really specific.
If we have a resident who's already applied, scheduled for a test.
Yeah, so if they've, so yeah, they just need to go to the website. The biggest thing I always tell our students is like, you need to do it early because the committee only meets at certain points in time. And they usually require that documentation be reviewed on multiple occasions. So sometimes in those cases, NBOME will also recommend that the resident or the student actually delay their exam to some degree if they can until they can actually make a decision. But for our students who are getting ready for complex level 1 next summer, I already am discussing this with them. Like we need documentation from you by probably December so that NBOME has 6 months to make a decision because that decision making process takes a lot of time. A lot of times those are denied on the first attempt almost always anyhow. And so you're going to have to submit an appeal. But yeah, so they're the combinations that are usually more easily approved, things like diabetes and lactation and pregnancy. Those are things that usually don't require an appeal and can get approved in 30 or 60 days. But anything outside of that, it's going to take time.